Hey mamas, welcome back to another video. So today we are here to talk all about home birth versus a hospital birth, the pros and cons, and hopefully you'll make your mind up whether you want a home birth or a hospital birth. So keep watching. And my name is Sweeta. I'm a registered nurse in the LA area, here to share my mommyhood journey with you all. So if you like this video and want to see similar content, please hit like, subscribe, share, and continue watching. And also, I have a brand new built course all about pregnancy from first to third trimester, and it's very in-depth. So for all you mamas out there who need more information, check out the link in the description box and see you there. A planned home birth can be a rewarding experience, but it's more important that you consider the benefits and drawbacks and plan accordingly, and also understand the risks if this is an option you're actually considering. Let's talk about the pros and cons of a planned home birth. You will need to work closely with your doctor so you can make the best and most informed decision for you and your family, especially for your baby. So, what is a home birth? A planned home birth means you'll give birth at home instead of a hospital or birthing center. You'll still need the assistance of someone experienced and qualified during labor and delivery. This usually includes a certified nurse midwife, or a certified midwife, or a midwife whose education and licensure meets international standards, or a doctor who practices in obstetrics. If you're considering a home birth, please discuss it with your doctor because they should be able to explain what you can actually expect during labor and delivery. Also talk to you about potential complications and how they would be managed in a home setting. Your doctor should be very clear and honest with you about all possible risks, because planned home births are associated with double to triple the risk of infant death or severe injury than births planned at the hospitals. This statistic may sound startling, but even with that increase, the risk of infant death with a planned home birth is low. If you're a good candidate for a home birth, the best thing to do is to start researching and planning, and of course, speaking to your doctor about it. Let's jump into some home birth safety tools. It's not safe for all women to give birth at home. For example, women who have had a prior C-section or who are pregnant with multiples like twins or triplets should not have a home birth. So again, check with your healthcare provider to see if a home birth option is for you. Be aware that even with a planned home birth, your doctor or midwife may recommend that you be moved to a hospital after your labor begins. This recommendation might be made for the following reasons. You may either have high blood pressure, high blood sugar, which is also known as gestational diabetes. You desire pain relief that really cannot be given when you're at home. Your baby is not in the correct position. You have vaginal bleeding that is not related to the bloody show. Your baby is showing signs of distress before delivery, such as an abnormal heart rate, or even after birth, signs of a medical condition or difficulty breathing, or your labor isn't progressing. Traces of meconium are found in your amniotic fluid. You experience complications like placental abruption when your placenta is detached from the lining of the uterus before delivery, or even umbilical cord prolapse. I mean, there can be so many different complications. So again, you really need to discuss with your doctor whether a home birth is for you and your family or not, especially given your background, your medical history, your pregnancy history, and really talk and do your research before jumping into getting a home birth. I have no problem against a home birth. I know many of my friends who've had home births and they were successful, but I've also read and seen news out there with some not so successful pregnancy, home births, and so I don't want you to be in that boat, mama, because you want to hold your healthy and beautiful child in your arms. But let's just jump into some cons of a home birth. So with the home birth, your insurance policy may not cover any associated costs, so you gotta check with your midwife or doctor to find out more. In the event of an emergency, you'll need to go to a hospital. Time could be of the essence, literally. Being able to reach a hospital quickly is recommended. And if a home birth is something you'd like to pursue, be sure to choose a trained healthcare provider who has had experience in home births. Birth is also very messy, and you'll need to be prepared with clean towels and plastic sheets. And in the event of an emergency, you really do need to go to a hospital because timing is everything. So create a birth plan with your doctor's approval. You should understand that instead of having your temperature, pulse, blood pressure, and the baby's heart rate continually being monitored, these things will be only checked periodically. So you really won't know how your baby is doing. You won't really know how your blood pressure is. So it's also important that you're prepared for the possibility of a hospital transfer and that you have plans for that possibility. You have to choose a pediatrician, make arrangements to have your baby seen within the first days following birth, and just be prepared. You're wondering, how much does a home birth cost? With the home birth, your insurance policy, again, may not cover any associated costs, so check with your insurance provider for more information. You will still need to work with a midwife and/or a trained medical professional, and their costs can vary widely depending on where you live. If you give birth in California versus Minnesota, it's a totally different cost. And with a hospital birth, you can be rest assured you have everyone there to help you. You have all the right medical equipment. Your baby is being monitored at all times. So are you. Your blood pressure, your vitals. You have a doctor on call. You'll have your doctor there. You have nurses. You will have the option to get rushed into an emergency C-section if needed for any reason. So just know that in the hospital, it's more of a controlled environment versus being at home, which is kind of like fear of the unknown. So again, mama, you will make that ultimate decision with your family and with your doctor. And I hope you found this video helpful and educational. If you want to watch more videos like this, please hit like, subscribe, share, comment, and keep watching. And again, check out my full-on in-depth course about the pregnancy journey and how to have a safe and confident pregnancy. All that link is down in the description. So keep watching. Thank you.